Go ahead and get started. Good afternoon, everybody. If we haven't met yet, my name is Hillary, and I'm the Communications Community Outreach Coordinator at Mission West Virginia for the THINK program, which is our Teaching Health Instead of Nagging Kids, Teen Pregnancy Prevention, Healthy Relationship Education program. See if I can get started. I'm loving all of the Zoom challenges. I think I'm pretty sure I'm live streaming this to my personal Facebook page right now. So I apologize to anybody who may be trying to pick us up on Facebook. I'm going to try to get that fixed in just a minute and shared to Mission West Virginia page. So speaking of Mission West Virginia, we are a nonprofit organization located in Hurricane, and our mission statement is that we change the lives of youth and families. We promote positive futures by recruiting foster families, providing life skills education, and creating community connection. So that's just a little snippet sentence of the things that we're able to do here at Mission. We have two main programs. The first one that people are most familiar with is our Frameworks program, which helps recruit foster and adopted families for youth in foster care in West Virginia. We are pretty well known throughout the state. We don't place the youth ourselves, but if you have any questions or you want to get started on the journey to foster care or adoption, please call our office, talk to Cheryl, and she'll be happy to help you out. Here's the phone number, 1-866-CALL-MWV or 304-512-0555, or we'll be happy to send you a packet if you go to our website. The THINK program, which is where I have worked now almost 10 years here at Mission with the THINK program, stands for Teaching Health Instead of Nagging Kids. And like I said earlier, we're a teen pregnancy prevention, healthy relationship education, kind of all things high-risk behavior prevention program. We serve 29 counties in the state, primarily middle school and high school youth. And we do most of our programming with the health classes in our middle schools and high schools. And the curriculum that we use does match the state health content standards and objectives. So we are able to go into the schools and do full programming that way. So, like it just said, we prevent teen pregnancy, STD prevention, healthy relationship education, positive youth development is just a huge platform for us, and then parent and community education. We also offer workshops and trainings. My favorite one right now is Hidden in Plain Sight, where we will set up either just bring in a small table and we can do a quick lesson on some of the little trickier things that teens are using to try to hide their high-risk behaviors right now, or we can set up a full teen bedroom, kind of almost like a game where you can go in and try to find any clues or signs of substance use or high-risk behavior with the teen. So that's a fun one that we've added in the past couple of years. We do talk about how to talk to your youth about sensitive topics. We do a trauma-informed training, sexual assault prevention and consent trainings, teen dating violence, and there's a lot more. And honestly, if anything high-risk behavior prevention for youth, we probably have something we can work with. CEUs are available for today's webinar. If you're interested in CEUs, shoot me a little message, or better yet, send me an email. I'll put my email up in the chat box, but it's hgore@missionwv.org. That's hgore@missionwv.org. Just to give me kind of a little sign-in. We'll also have an evaluation that will be sent out once this is over. If you could complete that, please. And then I will get your certificate emailed to you, and it'll also be available to be printed from our website. All right, Claire, I am now done. And I'd like to introduce Claire Dudney, who's one of our newest educators. She has a nursing background and she's amazing, and we're super excited to have her on board and to have her share this STI training with us today. And it should be fun. I'm going to give it all to you.
See if I can make this work.
Let me unmute you.
Okay, can you guys see my screen now?
Yes.
Okay. All right, so my name is Claire Dudney. I joined Mission West Virginia in October of 19. Before that, I was a registered nurse for 14 years, mainly labor and delivery, but I also worked pediatrics and in the NICU. So during that time, I saw a lot of young and unprepared couples having children. Many a times it was clear that these couples came from families that were dysfunctional, and the children that were born to these couples would be going home to underprepared and undersupported homes. So as a nurse, part of my job was to give these parents and their families kind of a crash course in parenting before they went home, which is a huge challenge. You know, you're there for 2 to 4 days, and now we're teaching you how to be a parent. It was a big undertaking. So in the field of medicine, we know that prevention is key. So when I decided to step away from the bedside and I heard about the educator position at Mission West Virginia, I knew it was a wonderful opportunity for prevention that was so greatly needed. So today I'm going to talk to you about how to talk to teens and sexual health, with the emphasis on discussing STIs. And as a warning, if you're working at home, there's no images on the screen that would be concerning, but you might hear some things. So if you have little kids at home, you might want to put on headphones. Okay, so stigma. Our ultimate goal when teaching sexual health to youth is to provide them with information to lead them to make healthy life decisions. It is vital when teaching about STIs that we refrain from using shaming or language that would place stigma upon those that have contracted or are already living with an STI. When we teach and talk about STIs in majority of terms that are gross or life-altering, it's not going to decrease the risk of contracting an STI, but instead decrease their likelihood of regular testing and treatment. This is especially important considering over 50% of the time, people do not report any signs or symptoms. Teens are greatly influenced by their peers, so if the group determines that something is gross, it's going to influence their choices, like going to the clinic for birth controls are already embarrassing for many teens. So adding the fear of getting regular testing and the possibility of becoming positive for an STI and then being deemed dirty or gross will keep these teens from seeking medical treatment when it is needed. So as an educator and as a nurse, it is my duty to normalize annual exams, which include STI testing, and encourage them to talk to their partners about having a protection plan. So this was a fun little image search that I did. These are all images that were used for the military like around World War I, World War II era. These were PSAs that portrayed venereal disease as a killer and would prevent you from having a future and a family. These types of images would give a clear link that loose women and prostitutes were even calling them agents of the enemy were the root of the evil instead of promoting protected sex. These were led mainly by the Division of Social Hygiene that started in the Progressive Era, which is like the early 1900s, and that has now evolved to the American Sexual Health Association. So now STIs were a big concern for the soldiers at this time, and in 1943, treating gonorrhea took 30 days, and syphilis took 6 months. So not very conducive when you're in war. So just because these images are so great, I wanted to share some more. So even though condoms were available at this time, they were not giving them to soldiers. I'll discuss with you later what they were giving them as an alternative. But these are just, so this is where we started in kind of modern times of this stigma. And now we have to combat the jokes, and we hear this a lot, you know, and on television shows, in the classroom, and you know, STIs have become the butt of jokes, and no one wants to be the butt of the joke. So it's our job as educators to convey the message that STIs are not a joking matter, but in fact, and many times treatable or at least manageable and a serious health issue. All right, so how do we recover from this? So we learn from our past to make our future better. So clearly these fear tactics don't work. So we need to find a new way to talk to youth and general public about STIs. So in the 1990s, the term STD replaced venereal disease, and now the American Sexual Health Association suggests that we use the term STIs, or sexually transmitted infections. The reasoning, as listed on this screen, is that the term disease is more associated with clear signs and symptoms. Signs are things that are visible or measurable, like rashes, sores, temperature, swelling, blood pressure. Those are signs. Symptoms are things that are not visible. These are like headaches, fatigues, general aches and pains. So around half of the people that are infected with STIs will not display any signs or symptoms, or have mild signs or symptoms. And testing is the only way to know for sure that you are infected and could possibly spread any further infection. All right, so the impact on teenagers. So according to the CDC, a little under half of teenagers are sexually active. They make up for a quarter of the sexually active population, and they account for half of all new sexually transmitted infections that occur in the United States. So why are teens such a high risk group? Here are some examples on the screen. So they're having multiple sex partners, unprotected sex, engaging in risky behaviors like drinking or alcohol that would make them not likely to make good choices. Only 12% tested in a year. That's not good numbers. A big one is they don't perceive themselves at a risk, and that prefrontal cortex has not been developed. So again, they're not making great decisions. So I also like to remind them that infections don't have a type. They don't care how old you are. They don't care where you live. They don't care how much money you make. They don't care if you're a good kid, on the honor roll, come from a good family. They see viruses and bacteria, see a host. They want a mucous membrane, and they don't care whose it is. All right, so some long-term effects from untreated bacterial STIs. So chlamydia, gonorrhea, and syphilis, what we're talking about here, all of them carry risk of contracting HIV. When these infections are localized in the genital regions, you're going to have higher white blood cell counts in that area. So if you have sex with somebody that has HIV, HIV loves white blood cells. There's more white blood cells to be had, the higher your risk is to contracting HIV. That's kind of how that works. And also, if you have inflammation, then the blood vessels in your genital regions might be more likely to break, so there's more blood transmission, so you're at a higher risk. Syphilis has really bad lifelong issues that can ultimately lead to death and basically eats away at your body. It's pretty gross. But all now very treatable with a shot of penicillin. So the long-term effects are something that we need to make sure we're conveying to them. Another one that's carried with mainly bacterial infections, is pelvic inflammatory disease. When teenagers are just seeing these exterior images of sores and discharge, they don't really realize that a lot of the damage is done to the inside, and these things can cause permanent abdominal pain and infertility, more so in women, but also can happen in men. So we need to let them know that damage is being done inside. All right, so when I hear kids say, well, why do I need to use a condom if everything can be treated? Here is why. Bacteria can become resistant to antibiotics, just as in the case of gonorrhea. We are very close to having uncurable gonorrhea. We're running out of antibiotics, and probably a few more years, the treatments that we're using now are going to start becoming ineffective. And sorry, my chair is super squeaky. And just like HIV kind of came out of nowhere, we don't know what could be the next sexually transmitted disease. All right, some effects of bacterial STIs in pregnancy. Being a labor and delivery nurse, this one's really important to me. Congenital syphilis is on the rise in the United States. It carries a very high risk to the fetus. It can be transmitted through the placenta, and cause birth defects and has a high risk of death. Protection should not stop after you are pregnant. It is important that you think beyond yourself and protect the child that you are carrying. When I'm in the high schools, I do show images of infants that are born and have been affected by STIs, mainly these bacterial ones, but also herpes as well. And those were really impactful on those kids because it wasn't like, they kind of got to think about, this is more than just about me. So also these infections, so any local infections when you're pregnant can have a high risk of causing preterm labor. So even having a urinary tract infection can cause some preterm labor. All right, so long-term effects of untreated viral STIs, hepatitis, B and C, HIV, HPV. So the hepatitis, those cause liver damage, so that can lead to liver failure. And you need your liver, it's a filter in your body. HIV, of course, that attacks your immune system. And HPV, which is the human papillomavirus, that is can cause different cancers. There's like 200 different strands of HPV, and there are some that will cause cancers. And any viral infections that are not treated can also be transmitted to a fetus. Right, so here is a chart that I also show the kids. This is a mortality rate. This was from 1999 to 2010, so kind of older data, but this was just the United States and just women and their reproductive ages. So I didn't have the ages on here, but I'm imagining it was probably from 18 to 40, somewhere in that range. So in a 10-year span, 31,000 people died in some form related to having an STI. All right, so not technically an STI, but this is something that I do like to bring up. Bacterial vaginosis is linked to having multiple or new sex partners. This is when the bacteria in the vagina, the good and bad bacteria, becomes imbalanced. So not necessarily an STI. It can also happen when you're pregnant or go through different hormonal changes. Sometimes the bacteria in your body just comes out of whack. But it is related to having multiple or new sex partners. So I like to link it in there. And urinary tract infections. We do see this rise after people become sexually active. So it is when E. coli enters the urethra. E. coli lives in fecal matter. So I always tell young ladies, you need to go and pee right after you have sex because that does kind of help flush that out. Another thing to mention is if you are having vaginal and anal sex, you need to change a condom if you're going from one to another because you can introduce bacteria where it does not need to be. All right, so when we're having a talk, you need to be prepared to answer and ask all the questions on all the topics and aspects of sexual health. All right, so we know that this style of sex ed does not work. This kind of piggybacks on those images that I showed earlier. Youth should understand how things function and that sex is important just from the biological side as it is from the emotional side. But don't talk about just the negatives and dangers. If you come at them with the dangers first, you're going to lose your audience. And it's just as important not to downplay the negatives, but you don't want to lead with them necessarily. You have to keep a balance. All right, so the better form of sex education is inclusive, it's holistic, it's science-based. If you're in the classroom, you need to use an evidence-based curriculum. It's about talking and listening. If you are a Schitt's Creek fan like me, you might remember the scene where Johnny Rose is talking to his adult children and they're entering in some relationships and he says, we need to protect our hearts and our parts. I kind of love that approach because it's what I call the how and why. So the hows are the biological and physiology, the whys are the emotional and sociological and feeling parts of it. So when we teach in the classroom on my first day, I like to start off by talking to the students about what expectations I have for them. I start by telling the class that everyone has the right to feel respected and valued. And while we do play games and have fun and do different activities, there are times when the topics are serious, and I do not tolerate any kind of jokes about violence, abuse, sexual assault, or STIs. Setting boundaries and rules are important, whether you're in the classroom or you're one-on-one with your own child at home. All right, so some things to keep in mind. We want to give these teens information about Title X clinics, emphasizing that they are confidential and they are free. I went into the Lincoln Primary Care and I said, you know, told them who I was and what I was going to be doing. I said, can you walk me through, if I was one of the high school students that came in, kind of walk me through, tell me what to expect. So I kind of just give that information to my kids that ladies, you don't have to have a pelvic exam if you're going into these clinics. The testing, usually they just, depending on your risk levels, they'll just have you pee in a cup, they'll test that pee, and then you can get your birth control. If the physician or provider does think it's necessary to have a pelvic exam, then they will do that. But generally speaking, there is no exam part to it. So testing, treatment, and various birth controls are free, and the birth controls might depend on what site you're in, so you might just have to find out what site you want to go to and what form of birth control that you are looking for. Dual protection, I will talk about that later. Clear and correct information. And this conversation needs to be ongoing, that changes as their needs change. And consent and personal safety is another topic we need to cover. All right, and then, so this isn't something that I have encountered many times as a nurse, a mother, and an educator, is what I'm going through normal, is what's happening to me normal. Kids are scared that something is abnormal. So if kids and teens are taught medically accurate anatomy and physiology, and if they don't know the difference between if something is normal or something that requires medical attention, our bodies do lots of things. Some of it seems gross, but it's normal. So an example I'll give is, since we're talking about STIs, vaginal discharge. This is an occurrence that is normal and increases as a girl is becoming to the age where they're going to start menstruating. So if we are in the classroom and telling them that discharge is a sign of an STI, and they're like, oh my gosh, that happened to me, they might think something is wrong with them when their body is just doing their natural process. So we know that giving them this knowledge is going to help them navigate through the changes that their body is going through. Bodies, emotions, thoughts change so much during puberty. It's difficult for them to process all they're experiencing. All right, so we want to start early. We want to talk to our kids about their bodies and what they do and how they develop. We want to have this conversation and using the proper anatomical terms for their own safety. And it does make the merging from that conversation of, going through puberty into sexual health, having a sexual relationship, it makes that transition a little bit easier for you and the kid into a teen. You want to let them kind of lead the conversation. You don't want to go in talking to, like if you're one-on-one with your child, you don't want to go talking about something that's way out of what their knowledge base, and they're like, what is going on? So kind of start asking them questions, let them kind of lead the conversation, and then kind of build on that. The other thing as a nurse, teaching them proper anatomical terms. I can't tell you how many times women would come in to have a baby and didn't know that they had a urethra, which they peed out of, and then a vagina, which they would have a baby out of. And when we would put a catheter in their urethra, they'd say, well, how is the baby going to come out? Well, you don't pee out of your vagina is how. And Or they would just say, there's something going on down there. Like you're about to become a mother. You need to be comfortable saying vagina. So we need to make them comfortable early on. So I suggest start using some diagrams like these. They're very benign. They're not too scary. In the middle school, I'd hear a few chuckles when this comes on, but this is a good place to start. It's labeling things. You can point at it and say, and this is what this does, and this is what this does. So these are a little less scary than popping up like a real life picture of a person. You can find lots of different images on the internet for these. All right, so now we're going to pretend that we've gone through teaching them all about puberty. So now we're going to have a plan for when things get more difficult. Now we're going to talk about actual sexual relationships and things. So we want to be proactive. We want to have this conversation before we think that our youth are having sex. So that's kind of why we start in the middle school and we kind of work our way and build our lessons into the high school. And especially if you're a parent, you want to start talking to them about this before they have a serious partner and you think, well, it's too late now. We want to talk about self-worth and their meaning behind sex. Again, this is the protect your hearts and your parts. So for everybody, sex has different meanings. People have sex for different reasons. So you just want to make sure that they're not going out there having sex to fill some other sort of void that maybe they actually might need therapy for or a friend for. So we're, again, not just going to talk about the negatives. We don't want sex to feel scary or wrong. We want to do the research together. We want to help them find medically accurate sources. And if you're doing this one-on-one, then you want to make sure that you have some privacy or you're in an environment where the kid is comfortable. Some kids might feel comfortable talking to their adult, you know, while they're in the car. Other kids might feel kind of caged in by that situation. So maybe going for a walk or going for a hike or cooking together, some kind of information, some kind of activity where you might be, you know, not having to necessarily make eye contact, but you're also alone and you can focus. All right, and also we want to teach about STIs and pregnancy and a biological aspect. So this gives them a better understanding that it is a medical issue and not a moral issue. And once they have a clear understanding of the functions, then we can emphasize sex in the terms of a relationship and emotional attachments. So that kind of goes back to that how and why. All right, so dispelling myths. So over here, this doughboy prophylactic, this is what the military was issuing their soldiers. This is it came with a couple of different things. There was an external wash, which was some really hardcore caustic soap. And then a tube, or like a squeezy tube that had a metal, almost like a needle, but blunt ended, and you would insert that into your urethra and inject that to kill any bacteria inside. And as you can see from the label, it's essentially mercury. So one, this did not help. Two, this probably led to a lot of long-term health issues. So instead of issuing condoms, which were available at that time, they were issuing this, which did not help. And then the dial soap. This is antibacterial soap. Can I just wash myself and wash away the germs? No, the bacteria and viruses go into the urethra or different cavities, wherever, and you can't wash that away. That is actually something that I did hear, you know, just wash with some soap and you'll be all good. All right, so words have power. Being a nurse, I like to impart my medical knowledge to others. So if you have a kid that maybe contracted HPV and is having some warts on their labia and they don't want to necessarily go into a doctor and say that, they could say, I have felt or I saw a condyloma on my vulva. They might feel more comfortable. So if you go to tabors.com, that's a medical, primarily I think a nursing textbook, and you can look up all kinds of different medical terms. So these kids don't have to go in there saying there's pus, there's discharge. Like you can find some other kind of better way, as Dwight said, spin move, make it sound better for them. So it kind of gives them a little bit more confidence. Maybe it doesn't just sound better to them, but they can also go into that provider with a feeling like they have a little bit of power in that situation. All right, so this is a little activity I do in the middle school. It's called Which One Is the STI? So I have two different viruses here. So I would say, which one is gonna cause and whatever. So they would like guess which one it is, and then we would reveal that this one here is the flu and that one is HIV. So this is another way. So in the high school, I do show the typical images of sores or things on genitalia, but in the middle school, I do not. So this is something, before I show this, I say, all right, are you guys ready to see a picture of what, you know, different STIs look like? And then I pop that up. They're like, oh, that's not so scary. And again, here's one. So which one is what? And we have gonorrhea and strep. All right, so another thing I like to do, this is more with high school, our case studies. This is something that we did in nursing school a lot. We would be given a different scenario about a patient. So you could write up different scenarios, have the kids kind of break up into different groups, and they could run through the scenario together, maybe try to diagnose what the patient has, and then kind of go from there. What should that patient do? Should they go in and get tested? Kind of treatment they would get. So you could even also like have them go to like the CDC website and kind of like type in some symptoms, look up what the treatments would be and what would they do from there. So this is just another way to kind of put a different spin on it. It kind of puts them in a different side of trying to figure things out. All right, so when talking about prevention, there's abstinence, condoms, dental dams, mutual monogamy, and vaccines. So all of the kids that we should be teaching should have had, especially to be in a public school, it's state law, they should have had the hepatitis B vaccine. So we can kind of, hopefully kind of cross that one off of our list of worries to an extent. And then HPV, there is now a really good vaccine for that. It's covering the strands that cause cancer and even some that cause the condyloma or warts. For now, that is a series of 2 shots, and it can start at age 11. So even though we do list mutual monogamy as a form of protection, I never tell high schoolers not to use a condom. I say, this is an option, but I always recommend that you use a condom. All right, so the dual protection. So these LARCs, long-acting reversible contraceptives, these are our IUDs or implants. These have really been a huge help in bringing down birth control, like bringing down unwanted pregnancy numbers. So they're a great form of reliable birth control. However, I think this has also brought down the use of condoms, possibly. So we want to emphasize, yes, you have a 99.9, protection. However, you have 0 protection from an STI. So you need to link those two together. We can never forget the condom. All right, so we need to tell them about the proper ways to use a condom. There's a lot of room for error in them, so we need to kind of go over, you look for any signs of damage, you want to look for the expiration date, you don't want to keep it in your glove compartment where it's going to get super hot, you don't put it in the freezer to stay fresh, so no extreme temperature changes, don't put it in your pocket, go over these things. Using lube, even using water-based lube or silicone-based lube is going to help a condom from breaking, so encourage them to use lube. And it also would help with sensation. So they'll say, well, it doesn't feel as good. Well, use the lube. It's going to offer you some help with protection and it's going to increase your sensation. So use it. And then I don't think any of the kids that I taught in Lincoln County will have any excuse because I reiterated over and over and over and over. What do you do at the top? You squeeze out the air, because we know that condoms break when there's air in the tip. So I reiterated that over and over and had them recite it back to me over and over. And so sex, oral sex, and STIs, this is the topic that probably gets the most jaws dropped in the classroom. They do not realize that oral sex you can get or transmit infections. So our bacterial infections, HPV and herpes, are the ones that are more commonly transmitted through oral sex. So protection during oral sex is just as important if you're having vaginal or anal sex. So if you have an infection in your throat that is whatever bacterial, or we'll go with bacterial, if you then go into your doctor's office and pee in a cup, that urine test is not going to prove or not going to show that you are positive for an STI because it's in your throat. So when you go to the doctor, you need to tell them who you're having sex with, not names, but what type of person you're having sex with and where on your body you are having sex. Because if you come in and say, well, I had oral sex with my partner and now my throat is really itchy, my glands are swollen, you might have an STI in your throat and you need to get treated. But if you go in with these symptoms and then you pee in a cup, it's not going to be positive. All right, so I think Stanley would approve of this. I would hope so. With great pleasure comes great responsibility. So we need to drive home to these kids and teens that testing needs to be synonymous with having being sexually active. We need to talk in terms that this is a routine health exam, just like you go to get your car inspected every year, you go to get the oil change. It needs to be routine. You just need to do it. It's not super invasive. And if you're going to play the game, you need to go get checked. All right, so methods of testing. For gonorrhea, chlamydia, and trichomonas, it is a urine test. For syphilis, HIV, herpes, Hep B, and Hep C, it is a blood test. And for human papillomavirus, it is a pap smear. So the pap smear guidelines have changed. It used to be when you're 18 or sexually active, you would get a pap smear every year. And then they kind of changed it to every couple of years. So now the recommendations are 21 years old. And then I believe it's every 3 years after that, depending on what the culture kind of comes back as. And this could still potentially change. I know in Australia, they start at the age of 25. So you just need to talk to your provider, see if you are at risk, and they will kind of help you determine how often they need to do it. All right, so when should you get tested? So if you are sexually active, you should be going in at least every year. If your partner has symptoms, you need to go get tested. Sound like that comedian. If you think you are at risk, you might need to go get tested. If you become pregnant, you need to go get tested. And if you have a positive test, you get treatment, then you need to go in for your follow-up. If you are positive, you get treated. You need to wait at least a week after taking your antibiotics, and probably even preferably get that follow-up negative before you start having sex again with your partner. So talk to your provider to see how often you need to get tested. There are different risk groups. Here, I'll show, oh, no, well, that screen went away. There are different, if you fall into different risk groups, you might need to get tested more frequently. So this, at the bare minimum, every year, some people need to get tested more frequently. So there is a guideline on the CDC, so you could look, see what risk factors you fall in, and you might need to get tested more often. All right, condom and testing refusal. This is a clear sign of disrespect. This is not a sign that you don't trust your partner. A healthy sexual relationship is free from infections, unattended pregnancy, violence, and pain. I just recently heard that. It was a professor at a university in Australia, and I thought that is the perfect definition for a healthy sexual relationship. It should be free of infection, free of unattended pregnancies, and free of violence or abuse and pain. Oh, here it is. Here's the when to get tested. So some people might fall into a higher risk group, and so they might need to get testing more frequently. So you just need to know what your risks are. Here's another one. I got asked this a lot. When do I need to go see a gynecologist? This is from ACOG, which is the American College of Obstetricians and Gynecologists. You can download this from their website. This kind of tells you reasons why you should go before you're 21, and this is dated. This is from 2015, so they might have a newer view on it. But certainly if you are sexually active, you need to be going to a Title X clinic, which are board approved physicians. There's nothing wrong with going to a clinic. All right, so can you have the talk with your partner? Partners should feel comfortable talking to each other about sex, protection, their not HIV, but STI status. If you do not feel like you can have that conversation with your partner, that is a red flag in your relationship. If you try to talk to your partner about going and getting tested and they say, well, I'm not cheating on you, that's a red flag. You need to be able to have an open and honest conversation. This kind of falls into the expectation lesson that we teach. Like if I am sexually active with my partner, I would expect them to get tested every year. You know, put down what your expectations are. So you need to make sure you're being respected in your relationship. All right, and so where to find this medically accurate information? We do not want our kids and teens to stumble upon doctored images, pornography, or just false information. So we need to be there with them to help them find where to get this information that's going to lead them getting medically accurate and helpful knowledge. So here are some good websites to start with. The CDC is always a good one. Planned Parenthood has some great information. The ACOG has good up-to-date information. And then kind of more geared for teens is the Sex Etc. and the AMAZE. But these are really great, and you need to make sure that you're checking in frequently because recommendations and guidelines do change. Knowledge change, treatment changes, testing changes. So we need to keep up to date on that ourselves. So that is all that I have for you today. Thank you for listening to me ramble on. So I hope I was able to impart some useful knowledge, or at least entertaining knowledge for you. Hillary, I'm going to give it back to you now.
Sorry, guys, I was in the chat. If you need CEUs for today, please email me at hgore@missionwv.org. I just put that up in the chat. Or you can send us a message through our Facebook page. I'll get that as well and let me know. Thank you so much, Claire.
Thank you.
I love all the old advertisements.
It was a rabbit hole I went down.
Our next webinar is scheduled for September 10th. We're going to be celebrating Recovery Month, and we'll have Barry Ball here to talk to us about how the brain responds to opioids. So hope you guys can join us for that one as well. And again, if you have any questions, just shoot me an email or a message. Does anybody have any questions for Claire or? I don't see any. Thank you, Becky. I'll send out evaluation forms and the CEU certificates. All right, I guess that's it. Well, thank you.